This is Scott Becker with the Becker Private Equity and Business Podcast. Thrilled today to visit with David Pivnick. David's a partner at McGuireWoods. He's a brilliant sort of litigator in the healthcare area. A lot of false claims work, a lot of diligence work with private equity funds on what they should look at in an acquisition or transactions and so forth. David, let me ask you this question. What are you most focused on and excited about currently? What are you watching? What are you most focused and excited about currently?
Sure. I think what I'm watching and what I'm excited about is a little different. I'm watching and focused on where the DOJ activity is heading. We're seeing still a fair number of cases, and I think a lot of the trend lines that we've discussed before, continue to be areas of active interest for the DOJ. So particularly things like investigations and pursuing claims relating to the opioid epidemic and looking at those from a variety of angles, some focus on home health and hospice, and also a lot of activity around the lab space and some pain practices. And then I'm also carefully monitoring where there's activity and cases being brought against private equity funds who are invested in healthcare, either directly at the fund level, which we're seeing only in fits and starts at this point, which I'm happy to say, but we are starting to see some of those cases. But also looking at cases that are being brought against the healthcare platforms in which private equity is invested. So those are the things I'm focused on. I wouldn't say necessarily. I mean, I very much enjoy what I do, but I wouldn't say any of that necessarily excites me so much as just trying to stay on top of what's going on and where the DOJ's focus is, so that I can best be prepared to advise clients if and when issues arise. The things that excite me tend to be more outside of that sphere.
No, thank you very, very much. When you talk about the suits against platforms that private equity companies, firms have invested in, talk about that. Where are you seeing some of that action? Where are some of the areas that DOJ is reporting on? I used to see constantly the DOJ reports, we've made this much money from chasing this, from doing this. Is the DOJ as active as it's always been? And where are you seeing some of that activity? Whereas it relates to private equity platforms and so forth?
Sure. I mean, generally, I think the DOJ has been fairly active, and the number of cases has been high. The recoveries last year the DOJ had in terms of fraud enforcement and the prior year are certainly way down from the highs. The DOJ was recovering, closer to $5 billion a year in connection with fraud enforcement for a few years running, in that vicinity of sort of $4 to $5.5 billion. It's been closer to $2 to $3 billion over the last couple of years. I think in many ways that's driven by not having a larger volume of big dollar 9-digit settlements in those years. I think the overall activity and the number of filings and investigations being pursued still is fairly robust. And then in terms of where I've been seeing activity, I would not say that I've seen a trend or sort of a commonality in the type of healthcare platform where private equity is invested and the government is pursuing a claim. I've seen some of that in urgent care. I've seen some of that in connection with EMRs. I've seen some of that in connection with pain management and some of it in the lab space. So I've sort of seen it from different angles and in different subject matter. What I see more is a sort of trend of what types of conduct the government is focused on and the DOJ is pursuing, where private equity is involved and where private equity funds then get dragged in the case. And that typically comes up, where issues are spotted in diligence, and the private equity fund sort of leverages the diligence issue that's identified to get a price reduction or other concessions in connection with the transaction, but then doesn't take appropriate steps to correct the underlying concern going forward post-closing. We've seen some activity where the private equity fund is alleged to have been involved in sort of structuring the wrongdoing. So, for example, there's an allegation of a kickback scheme, and the assertion is that the private equity fund structured, set up, paid, etc., the purported kickback, and therefore it gets dragged in. And then the area that I think is most sort of esoteric and troubling is we've seen a couple cases where the criticism has really been at the board level of the platform, and the argument is that the board was aware of the alleged misconduct and wrongdoing and didn't take sufficient steps to correct and address it, allowed it to continue, encouraged it. We've seen different variations of that, but that has also given rise to claims. And I think that was the most troubling because it's the one where the alleged conduct is sort of least nefarious and is more a function of inadequate monitoring and corrective action as compared to actually, willfully participating in conduct that is problematic.
Got it. And it seems like the more that the private equity fund has knowledge of the issues and doesn't deal with the issues, the more potential culpability there can be.
I think that's right. And I think the main takeaway I have, and discussed this with clients regularly, is I think it's a good reminder, to be meaningfully involved in operations when you're participating in board meetings and moving forward, A, but B, to also be actively thinking about the compliance program, making sure you're getting reports from the compliance officer, if there is one, or from whichever other employee is responsible for the compliance function of the entity, engaging in appropriate trainings, both at the board level and at the platform level, to identify issues and have a process in place to handle them. I mean, it's very easy to put together compliance training for the board and also for the platform, both, to make sure that these issues are spotted and addressed, because I don't think the standard at all is perfection, but taking concerns seriously and at least trying to go through the process of properly evaluating an issue and figuring out if there's a resolution to be had or how best to resolve it is critically important.
Let me ask you a question about data and compliance programs. And it goes back to the issue on DOJ settlements and monies that they've gone after and gotten and so forth. It seems that it goes through waves of this, where the DOJ is so active, there's so much money being recovered, and people are so active with their compliance programs. Then it seems like we've gone through another period where people are so concerned about their ability to make margins to actually survive and thrive that there seems to be less attention on some of these issues. And I know that's not right or wrong, but it seems to be my observation that we see, like, at some points, people are so focused on the compliance issues. Now it seems like most hospitals and health systems, big practices, are just so focused on making their margins work again that their probably eye is not as fully on this. What's your sense of that?
I have not been seeing that as much. My general sense is that clients are increasingly focused on compliance efforts, and I think there's a scale. I mean, depending on the size of the business and various factors in terms of revenue, expenses, and what is realistic, I think people might take different approaches. Whether it's having a full-time compliance officer, whether it's bringing in compliance consultants, having other people who have sort of wear a couple different hats. But I see a lot more effort and attention on compliance, and I think that's sort of continued to be an upward trend. And I've seen an increasing amount of requests from clients for compliance training to the board of directors, and for us to weigh in on various compliance issues or help put them in touch with compliance consultants who could work with their internal compliance teams to make sure things are being done. I think a lot of people are viewing it, and I recognize your point on concerns about margins. I think that's fair, but I think a lot of people are recognizing the importance of the compliance program, that it's necessary to running a healthy and effective business, but also very significantly that the cost, even when it starts to mount on the compliance side, is going to pale in comparison to any actual issue materializing. And so I think it's being viewed in a lot of ways almost as sort of an insurance. Not that you're necessarily going to be able to avoid any risk by having an effective compliance program, but certainly you can identify such risks and try and handle them as effectively as possible. So, I mean, in my experience, I think we're continuing to see a lot of focus from our clients on that front, and a willingness to devote time and resources to ensuring effective compliance programs.
David, I want to thank you for that perspective. Truly extremely helpful. Thank you very, very much for joining us today on the Becker Private Equity Business Podcast. I always learn something. Thank you very much for joining us today.
Thank you for having me on, Scott.